Welcome, we hope this video helps in your understanding of prostate cancer. Do you have prostate cancer? Prostate cancer is one of the most common forms of cancer among men, affecting millions of men each year. This disease can be difficult to detect in its early stages, which is why it is so important to be informed about the symptoms and risk factors associated with prostate cancer. What is prostate cancer? Prostate cancer is a type of cancer that starts in the prostate gland. The prostate gland is located below the bladder and in front of the rectum. It is a small, walnut-sized gland that produces a fluid that transports the semen during ejaculation. The cancer cells in the prostate can grow and spread to other parts of the body, especially the bones, lymph nodes, and other organs. Risk factors for prostate cancer. There are several risk factors that may increase a man's chance of developing prostate cancer. Some of the most common risk factors include age, family history, and race. Men over the age of 50 are at an increased risk for prostate cancer, and men with a family history of the disease are also more likely to develop it. African American men are also at an increased risk for prostate cancer, with higher rates of prostate cancer incidence and mortality than men of other races. Symptoms of prostate cancer. In its early stages, prostate cancer may not cause any symptoms at all. As the cancer progresses, symptoms may begin to appear, including frequent urination, difficulty starting and stopping urination, weak or interrupted urine flow, blood in urine or semen, and pain or discomfort in the pelvic area. However, it's important to note that these symptoms can also be caused by other, non-cancerous conditions, such as an enlarged prostate or a urinary tract infection. The diagnosis of prostate cancer. If you are experiencing symptoms of prostate cancer or are at an increased risk due to age or family history, it is important to seek medical attention and undergo a prostate cancer screening. There are several tests that can be used to diagnose prostate cancer, including a digital rectal exam, DRE, a prostate-specific antigen, PSA, test, and a biopsy. A digital rectal exam, DRE, is a simple exam that is performed by a doctor. The doctor will insert a gloved finger into the rectum to feel for any abnormalities in the prostate gland. A prostate-specific antigen, PSA, test is a blood test that measures the level of PSA, a protein produced by the prostate gland. An elevated PSA level can indicate the presence of prostate cancer, but it can also be elevated for other reasons, such as an enlarged prostate or prostate infection. A biopsy is the only way to definitively diagnose prostate cancer. During a biopsy, a small sample of tissue is taken from the prostate gland and examined under a microscope for cancer cells. Treatment options for prostate cancer. The treatment options for prostate cancer will depend on the stage of the cancer and the overall health of the patient. Some of the most common treatment options include surgery, radiation therapy, hormone therapy, and chemotherapy. In some cases, a combination of treatments may be recommended. Surgery to remove the prostate gland, prostatectomy, is a common treatment option for prostate cancer. There are two main types of prostatectomy: a radical prostatectomy, which involves removing the entire prostate gland and surrounding tissues, and a partial prostatectomy, which involves removing only part of the prostate gland. Radiation therapy uses high-energy beams of radiation to kill cancer cells and shrink tumors. This treatment can be delivered externally, from outside the body, or internally, by placing radioactive seeds directly into the prostate gland. Hormone therapy works by lowering the level of testosterone in the body, as testosterone can stimulate the growth of prostate cancer cells. This treatment can be delivered through medications, or by surgically removing the testicles, which produce testosterone. Chemotherapy uses drugs to kill cancer cells. This treatment is typically reserved for more advanced stages of prostate cancer that have spread to other parts of the body. Prostate cancer prevention. Although it is not possible to completely prevent prostate cancer, there are steps that can be taken to reduce the risk of developing the disease. Some of the most effective ways to reduce your risk of prostate cancer include maintaining a healthy diet, engaging in regular physical activity, and getting regular prostate cancer screenings. It is also important to be aware of your family history and to discuss your risk of prostate cancer with your doctor. If you are at an increased risk due to age or family history, your doctor may recommend starting prostate cancer screenings at an earlier age or more frequently. In conclusion, prostate cancer is a serious condition that affects millions of men each year. By understanding the symptoms, risk factors, and treatment options, you can take steps to protect yourself and catch the disease in its early stages, when it is most treatable. If you are experiencing symptoms of prostate cancer or are at an increased risk, be sure to seek medical attention and undergo a prostate cancer screening. Please subscribe to our channel to learn more and ask any questions. Ellen and Michael Moriarty, 2 RNs.